Hi, everyone, and welcome to Your Healthy Dose. It's a podcast about current trends in healthcare, and I'm your host, Kym Douglas. You know, heart and vascular wellness are extremely important to maintaining a healthy life. And on today's episode, we're going to talk about heart and vascular care from treatment to prevention. So with me today, I have Dr. Shephal Doshi and Dr. Rigved Tadwalker. Dr. Doshi is a cardiac electrophysiologist and is the head of the Heart and Vascular Institute at St. John's. And Dr. Tadwalker is a consultant cardiologist and was just named the Director of Digital Transformation at the Pacific Heart Institute. Welcome to both of you, and thank you both for being here.
Thanks for having us.
Now that we got that out of the way, let's get into all of the good stuff. So when we hear about heart disease, most people immediately think heart attack. So talk about why there is so much more to heart disease than just the heart attacks.
Yeah, I think in layman's terms, and the general population thinks of heart disease as heart attacks and chest pain, and the classic stereotype of someone clutching their chest and falling over, and 911 and all of that. But the heart is a very complicated organ, and there's many facets to it. It's a muscle first and foremost, and the muscle can have many issues or problems with it, and it runs on electricity. And so you have the electrical side of it, and the electrophysiologists are electricians, but without good plumbing, you're not going to be able to feed nutrition to the muscle. So you need electricity, you need plumbing. So it's kind of like having a general contractor as a general cardiologist, then having electricians, having plumbers, et cetera. And so there's many different specialties, in terms of treating heart disease.
Wow, I love the way you put that. It just, as you said, in layman's terms, you can kind of figure that out that way, because you get very intimidated when you hear about the heart, So St. John's is world renowned for its management of atrial fibrillation, which I don't say every day, as we've talked about. But what exactly is that, and why is it important to diagnose and treat that?
No, that's a great question. Atrial fibrillation is called a cardiac arrhythmia, or an electrical short circuit of the heart. And the reason why it's become so important to discuss is that as the population ages, it becomes more and more common. 1 out of 10 over the age of 70 have this irregular heartbeat. A lot of it is related to aging. And there's other things that's happening in today's society, like increase in obesity, increase in diabetes, sleep apnea. All of these things promote the short circuiting of the heart, called atrial fibrillation. Because it is so common, and because it's responsible for 25% of all strokes, many of these that can be prevented by treatment, it's really important that we talk about it, because almost 1 out of 3 patients don't even feel their atrial fibrillation. They're unaware of it, and their first symptom is a stroke. So having a platform like this is very important, because it is becoming so common that it's important patients are aware of it.
Absolutely. And then can we talk a little bit about COVID-19 and, more importantly, specifically long COVID? So what impact does that have on the heart, and should we all be concerned?
In terms of COVID-19, so obviously always a popular topic, and certainly patients who are acutely infected with COVID-19 can have cardiovascular complications. We see it frequently when they come into a hospital setting. However, the thing that has now emerged and is being discussed is long COVID. So when we discuss long COVID, the most important thing that I try to get across to people is that it is a real diagnosis. So there are still both public and physicians who will dismiss this diagnosis and think that it's not real. But it is important to establish it's real. We may not understand everything about it just yet, but we know that it is a real thing. So beyond that, from a cardiovascular perspective, we see a whole array of different types of issues that arise when people have long COVID. And it can range from ischemic issues, which means just lack of blood flow to the heart due to complications related to the infection itself. It could be arrhythmic issues, including atrial fibrillation, which we have been discussing. It can involve the muscle itself, or even the sac surrounding the heart, called the pericardium. So there's a whole array of different issues that can arise, and we don't know the exact mechanisms behind this just yet. We think it could be direct infiltration of the virus into the muscle cells themselves, called the myocytes. We think it could be some sort of disordered inflammation some form of autonomic dysfunction. This is a part of the nervous system that regulates a lot of bodily processes. So there's a lot that we still need to learn. But the good news is that as we've seen more of these long COVID patients, we have now crafted a little bit more of a treatment strategy or an algorithm, so to say, where we can say, hey, you have, this spectrum of issues related to long COVID. Here are some things that might be that may help.
I think, but to reassure everyone, it's a very few or a small percentage of patients that actually get long COVID. Most patients that get sick with COVID recover and kind of recover in a full perspective, so they're back to themselves. And it's a minority of patients that still struggle. And what's interesting is it's oftentimes the healthy young patient that develops these long COVID symptoms. And I think that's what's most remarkable to understand why that happens. But, we just want to reassure the public that when you have COVID infection, which is inevitable, most people at least have had one bout with COVID, 99% plus do fine and recover.
Good.
Exactly. It's important that we mention that, because just because you have it doesn't mean that you will be afflicted by long COVID.
Thank you. That's so important. I think that's what our listeners and viewers want to hear as well. And thank you for that. That really is a very important question. But what causes a heart attack? Just to go back to that, and are there symptoms that we should be aware of that warn us of an incoming or an impending heart attack?
Sure. So a heart attack essentially occurs when there is a lack of blood flow, nutrients, and oxygen to the muscle of the heart itself. Now, classically, this is due to a blockage in one of the arteries of the heart. So this is what we think of as the classic heart attack. And as Dr. Doshi had alluded to a little bit earlier, sort of those classic symptoms of clutching the chest, nausea, things that we often see portrayed in the popular media as well. And this is a very common type of issue, and fortunately, in the modern era, is very treatable. Now, there are other forms of heart attack as well that relate to narrowing of the vessels. And when there are other precipitating factors and somebody already has a little bit of narrowing in the vessels of the heart, it can sort of turn into a different type of heart attack where there is a mismatch of oxygen and demand on the heart. So in these cases, the treatment may differ slightly, but still, this is a form of heart attack that requires urgent management. So that's essentially how a heart attack works and how it happens.
Yeah, and for patients, we always say, be aware of symptoms. There are a certain number of patients that don't feel it when they have a heart attack, and that happens. And a lot of heart attacks are spontaneous, where they're feeling fine 1 second, and next thing they have severe chest pain, chest pressure. But a lot of patients, when you really look at the history, say, I've been having shortness of breath for the past 4 weeks. Something has changed. I've been having tightness in my chest. This isn't new. These are the early warning symptoms. That doesn't mean they have to go to the ER, but they should notify their physician. And when you treat these patients early, this so-called angina, the term that's thrown out, then oftentimes you can rescue these patients so they never have a heart attack.
Oh, that's so important. And that's why I think, honestly, podcasts like this is so important to share that with the public. So now, if you've had the heart attack, what is the road to recovery like?
Yeah, so that road can differ significantly depending on the individual who's afflicted. So in the case of a classic heart attack that comes to medical attention early, in some cases, the fix from our perspective becomes quite routine, and people can be back on their feet within 24 hours, which is really remarkable when you think about it. Still, though, there will be, a recovery phase there, which may include cardiac rehabilitation, taking certain medications. So there are these lifestyle changes that are in order, and I often find are the most difficult part, actually, for most patients, because, lifestyle changes are the hardest to come by, right? So there's that. However, I will also mention that for some people, this whole journey of a heart attack is a very big issue, because if they don't really pay attention to their bodies and their symptoms, they present late, then the procedure itself can be complex. There can be complications that arise from the hospitalization. The recovery can be longer. So there is a lot of variability in terms of what that road to recovery looks like.
Sure.
And one of the unique things at St. John's, for example, when you think about it, we always have this comment or statement that say time is muscle. That is, when you get a blockage, the quicker you open up the blockage, the more muscle you save because the muscle is dying. That's why you're getting the severe chest pain because you're not feeding it with nutrition. And so it's important to open up the blockage as quickly as possible. And the reason Dr. Tadwalker is wearing scrubs today is he's on call.
I know.
and if there's an emergency and someone has a heart attack, we have teams that are ready within 15, 20 minutes that are in the hospital. And our goal is to open that blockage within 90 minutes of the start of the symptoms. And being in an environment where that can happen is quite important because if you can prevent that muscle damage of the heart, then it really affects the long-term outcome of the patient. Because if you sustain a major heart attack and lose a lot of muscle, then that's a really different type of recovery, as Dr. Tadwalker was saying, versus, you come in with a heart attack, we get in quickly, open the blockage, minimal damage, and you can have nearly a full recovery.
24 hours. Well, first off, he is in his scrubs and we might get a call. So I'm going to ask the questions really fast and you guys better answer them fast so we don't lose him. I'm just kidding, but it is true. You are in your scrubs and it's so good to have you here. So why is heart failure an emerging diagnosis right now and how is the patient treated?
Sure. So heart failure, it's interesting because you hear that term a lot more now than you ever had in the past. Part of it is awareness. We know what heart failure is, and we'll discuss that briefly as well. But the large reason as to why it's increasing is because of age, right? People are living longer, right? So when people are living longer, a lot of the conditions that can contribute to heart dysfunction exist for longer periods of time. Also, as Dr. Doshi was mentioning, there is more and more risk factors that people are accumulating. So large body habitus, obesity, hypertension, diabetes, all of these different things can contribute to a greater incidence of heart failure. So what's interesting about heart failure now as a diagnosis is this. In the past, when we heard of an individual who had heart failure, it was almost like a death sentence in a sense, and the name itself strikes fear, failure of the heart, right? So even if you go back into like the 1960s, 1970s in medicine, all we could really do is just decongest these patients, give diuretic medications, which basically help the body relieve itself of congestion or fluid. And then we have a drug from literally the 1700s called digoxin. And it's from a plant called the foxglove plant. And we would use this to help improve contractility of the heart. And this is pretty much where things were. Then we sort of fast forward to large clinical trials, 1980s, 1990s, beta blocker medications, ACE inhibitors, and now we have a whole gamut of different therapies that have sort of changed this diagnosis.
Yeah. I think it's very important for people to remember what he said. Patients get this term heart failure and they think they're going to die.
Oh, gosh.
And I say, doctor, it says I have congestive heart failure. I'm not going to die. And I say, all that means is your heart isn't able to meet the demands of what your body needs. That doesn't mean you're going to die. It just means that it's not strong enough or it's not able to do what it needs to do. And it could be mildly affected or it could be severely affected. And part of the reason why there's so much excitement is we also have so many therapies now. Mm-hmm. As you mentioned, some of them are medications, but some of them are also involve surgery and procedures that can make the heart stronger. And I think the key with all that we're going to talk about today is early intervention, early treatment. In the United States, they say that a patient typically sees their cardiologist once a year for 7 minutes. And that's kind of what we have to deal with is the access and the ability to communicate. And oftentimes it falls on the patient because the questions aren't always asked. Mm-hmm. And so it's really important that we discuss it and recognize that when you have that diagnosis, you ask your doctor, what does that really mean? Don't just assume it means that you have a death sentence.
Right. That is so important that you just said that. And I have to bring this up. We were talking earlier, a group of us at lunch, and just saying how there's actually this term called the white coat. Mm-hmm. And it's when a person like myself, a lay person, gets in the office, the door shuts, the doctor comes in, he's got a white coat and he could be having to save a life in a minute. And I had 8 questions I wanted to ask you, but now just check my heart and okay, bye, thanks. Yep. And that's why I think something like this is so important because we get to really talk to you guys and hear what you have to say. And the information you're giving is so important. And that leads me to my next question, Dr. Doshi. You recently had a mix-up with star football player J.J. Watt. What happened? And talk about the unintentional impact it had on heart health awareness.
Yeah, I think a lot of the issues we have in medicine is lack of awareness and the lack of understanding. And so a lot of patients, when I see them for a referral for atrial fibrillation, even though they've seen a cardiologist or they've seen an internist, they come and the first question they ask me is, am I having a heart attack? And I have to explain again, that's electrical, this is, this is electrical, that's plumbing, and explain the difference. So even when they're referred for something, they don't have a great understanding or know what the options are. And so I was asked by the Arizona Cardinals newspaper, an interview regarding the football player and him having atrial fibrillation because he's young, he's healthy, star athlete.
Yes.
And we always think that, this is only for 70 and 80-year-olds. How does a 30-year-old have it? And we see it in a lot of young people, especially those of us that specialize in it. And my comments were basically that there is a therapy now that is moved to first line, a minimally invasive procedure called ablation, where we can often fix the atrial fibrillation versus taking medications for years and years and years. And the question came to be that should this star football player undergo this procedure? And while I was discussing the risks, benefits, advantages of why the procedure is now first line versus taking drugs, the way it got interpreted by the press was that, oh my goodness, this player has to have this procedure and they're not giving it to him here in Arizona, and he needs to go see Dr. Doshi, for example, and get this procedure done. And so while that was misinterpreted, the positive impact was quite interesting. I've got many phone calls from patients who said, wait a minute, I have atrial fibrillation. I'm struggling with it. My doctor's never even mentioned this procedure. And if J.J. Watt should have it, why shouldn't I have it? Right? So just raising awareness through efforts through the press and even through podcasts like this, that if you have atrial fibrillation, you should request to see a specialist in atrial fibrillation because it's gotten so subspecialized because the therapies are so intricate. But the studies have shown that managing these diseases early leads to better outcomes, better survival across the board.
Yes.
And oftentimes we get patients who are referred 5 years after they've had it and just dealing with it, and somehow they ask the right question, they get referred. So as a consequence of that story, which I was a little bit misinterpreted or misquoted, we've seen many patients who actually need the therapy hear the term atrial fib and hear the term ablation who are now actually asking the right questions.
So good. I like that. Finding the silver lining, right? And this is something I'm really interested in as well, and that is prevention. So how does diet and exercise impact heart and vascular health?
Yes, it's a broad question. It's a big question, but it's an important one because diet and exercise are the foundations to good cardiovascular health. The reason I stress this to a lot of patients is because they are cheap and widely available, right? So people can avail of just the right knowledge, and that is often enough to keep their heart healthy. When it comes to exercise, we're really talking about physiology, improving physiologic function. So what that means is just how the body sort of utilizes oxygen, the metabolic processes, and how that functioning happens, reduction of inflammation, how hormones affect the body, and exercise affords us all of this. It allows our blood pressure to come down. It helps regulate our cholesterol levels. It can help us if we have what we call impaired glucose tolerance or prediabetes. So exercise is one aspect of this. From a dietary perspective, there's so much, and it's almost really a different topic, but in brief, there are some key elements when it comes to dietary principles that are important as it relates to heart health. So obviously, a high intake of vegetables and fruits, which you always hear, but really because of vitamins and minerals, right? Because those are really important for bodily functioning. We talk about whole grains a lot, right? Whole foods, whole grains, right? And a lot of that has to do with regulation of blood sugar. So carbohydrate metabolism and things of that nature, feeling full for longer periods of time, right? So you're not snacking as well. Lean meats, right, are very important when it comes to protein. So that's certainly something that should be reiterated. And many times when we see cholesterol abnormalities, poor heart health, oftentimes it's in the setting of a lot of red meat consumption. So that's an easy one to potentially fix, I guess, for some at least. And then we always talk about plant-based sources of protein. So legumes, beans, lentils. These are important because in some cases they have minimal or no cholesterol, right? So it's important to vary those sources of proteins. Minimizing sweets. So these are sort of, the important things, that make up a heart healthy diet. And as a result, we see a lot of cardiovascular benefit from, and people can do remarkably well with just these modifications alone.
Wow. And that's so great. I mean,
you see the impact of that in terms of where we live in the west side of Los Angeles. it's kind of much more common than my colleagues that practice in Southeast Louisiana, for example.
Right.
We have one of the lowest smoking rates in the country here in the West Side. And everything that Dr. Tadwalker said is just common sense, what your mother told you when you were little, right?
Right. Eat your vegetables and put on a pair of sneakers.
It's hard to implement.
And I think one aspect that we don't want to forget is some of this is still genetic. So you can do everything right. And when you see someone who is in their 50s and they have bad blockages everywhere, and you say, listen, I need to do this, I need to do this procedure, I need to put you on this medicine. Well, I'm just going to cut out butter. And it's like, well, that's not going to fix the problem. So I think you have to be open-minded. You have to listen to your physician, but recognize that some of the issues that happen may be genetic in nature and can't always be fixed with diet and exercise.
Right. And I think you just answered my next question, because it was, what else should we be doing besides diet and exercise? Is there more besides the genetic component?
So Dr. Doshi had mentioned a very important aspect of this is that for some individuals, there are other factors that sort of, can accelerate heart disease. But beyond diet and exercise, actually, there's this amazing document from a few years ago. It's from the American Heart Association. It's called the Life Simple 7. So diet and exercise are actually two of those characteristics that they discuss. But the others are stopping smoking. So if you're a tobacco user, stopping smoking, losing weight, which I know sounds very easy in theory, but if you can have some sort of plan that results in weight loss, then this is what we're really discussing. And then managing blood pressure, cholesterol, and diabetes for those who have those issues. And I believe that makes up all 7. And then that document was actually revised in the past year. It's called Life's Essential 8 now. And this is interesting because now this 8th element, so to say, is sleep. So sleep, right? Exactly. Yeah. Right. Because many of us neglect sleep, and we have learned in the past several years how important sleep is to cardiovascular health. There was a time when we'd say, hey, this is a respiratory issue, or hey, maybe it's not that important, but it's implicated in so much when it comes to heart disease. So we've learned that sleep duration is one piece of it, but there are probably other elements of sleep that are important as well. And when it comes to sleep duration, because people always ask, well, what's the optimal duration of sleep? So
8 hours, right?
That's exactly right. So it's somewhere between 7 to 9 hours with what we see in studies.
Okay, here's my one question. So I'm a night owl and I stay up really late and I love it. It's like quiet and I get to watch my documentaries or whatever, but that's probably not a good thing, right? If you're going to bed at 1 in the morning rather than 10, does that?
I think to a degree, unfortunately, because there's a daily sort of rhythm that your body has that involves hormones. And so when those hormones are disordered, this is where we often will see the onset of diseases. And so I know that can sound a little not too exciting, right? And of course, sometimes, when we hear about, we got to keep an exact schedule, it just seems kind of boring, right? But I try to remind people that oftentimes, if you have the luxury of being able to sleep at a specific time, get the right amount of sleep, have a routine, you will ultimately have a better quality of life.
So look, Kym, life is complicated, right? You can't always follow the 7 or 8.
Yeah.
So you do your best,
yeah.
But I think within that, we have to recognize what is the most important and what's important to a patient's wishes in terms of your quality of life.
Right.
And when you look at the cultures around the world that live the longest, they generally do a lot of walking, have simple meals, get a lot of sleep, and they don't Instagram. It's a simple
Why are
life.
you looking at me?
No, I'm just
and Dr. Tadwalker?
Nothing against Instagram.
Why?
I'm just saying, how we focus our mind and what we think about and leading a simple life. And it's really challenging in 2022 for any of us to do that, as we have 6 things happening all at once.
Thank you. Gosh, you're so good. I think we're going to have to end this. No, just kidding. We'll move on. But gosh, that's so true. The Instagram really hit me hard in the heart, pun intended. So you guys, okay, next up, wearable digital devices like an Apple Watch or a Fitbit are becoming extremely popular. So what kind of benefits, and do they even serve a benefit? Because I really do have my Apple Watch, and as you can see, I've taken like 1 step today. Just kidding. But I do count my steps, and I feel like, oh, look at me, I'm doing great if I get that 5 or 10,000.
Yeah.
Does it make a difference?
Yeah, this is a great question. And in fact, it's probably the thing that people want to know most about these days, because these digital devices have become ubiquitous, right? I mean, literally everyone has one. Even if you were trying to get away from it, you probably have one. I'm wearing one as well. Exactly.
I saw, you look at you. You've got your good classic elegant watch.
Yes. So what's interesting is this. So we are all tracking metrics on our devices, right? Whether we are intentionally doing it or not, but when we sort of look at these metrics, things that sort of pop out are things that you mentioned. So step count, is one of them, right? Resting heart rate becomes something that we look at as well, right? And then there's like a whole other, set of metrics that are sort of, insinuated or sort of calculated, and they sort of make good estimates on like calories burned, et cetera. So at first you'd say, okay, well, these kind of sound a little bit like vanity metrics, like who really cares? But at least a couple of those metrics are important. So we know that individuals who have low resting heart rates tend to have better cardiovascular outcomes. And this is a really important question because to answer, because a lot of people will sort of come to us and say, hey, my heart rate's really low, but I feel fine. Like, am I supposed to do something about that? And I'll say, you know what? No, that's generally good. And especially if you participate in some form of exercise or athletic activity, this could just be a sign of conditioning. So this is a good thing. In terms of the steps, it's actually kind of funny that you mentioned that. So people always ask about this 10,000 steps thing, right? So I actually had to go back and sort of look at the literature, and it comes from an advertising campaign leading up to the 1964 Olympic Games in Tokyo. And it was to sell a pedometer, or like an old school pedometer. That's sort of where they came with this 10,000 steps idea. But in general, it's not a bad metric. Because it sort of gives people something to aim for. But the truth is the more steps, the better. Like, we could have easily just said 15,000 steps, right? And then people would have even better outcomes. But 10,000 steps has sort of become, sort of a sexy metric, and people like to achieve it. And for many people, it's achievable on a day-to-day basis. So it's one of those things that sort of emerged. But in terms of devices, now we've sort of moved on to other things. Like, people are tracking sleep. They're tracking their heart rhythm.
Yes, the Oura rings and things. Yeah.
Exactly. They're tracking their heart rhythm as well. So now we're seeing that in the clinical realm. So Dr. Doshi gets so many consults for these as well, where sort of people say, hey, I saw an arrhythmia or atrial fibrillation on my watch. Like, what do we do now? And so this is really now crossed over, not just from a consumer and patient situation or sort of outside the clinical realm. It's actually come into clinical medicine. And so now a lot of the research and the activity that we do within the field is like, okay, well, how do we take care of these patients? How do we integrate those findings? And so that's really like the future of where devices are. And, we're seeing that often.
Interesting.
And, the ability to get an EKG on yourself just by wearing a watch or some sort of wearable is quite impressive. And, there's ways you can utilize that to your advantage. So many patients will get an abnormality. And what these devices are really good at is when they tell you it's normal. Because if you get a normal reading, those are usually the most accurate. Any kind of variance from normal could be incorrect or it could be abnormal. You just don't know. But when we diagnose these arrhythmias in patients who pick it up on their watch, at first we thought this was going to be such a nuisance that we're going to have calls left and right. And surprisingly, it's not as bad as you think. And many patients who come to us now with symptoms will already have an EKG of it because they had their wearable. And even if they didn't have it, they heard about it, they went and bought an Apple Watch. And before they would say, I've been having these symptoms like my heart is racing, I've been getting dizzy. And they come to us with that. Then we have to do all this. And now they say, well, I have all those symptoms, but by the way, I have an EKG of it when it happened from my watch. And immediately we can say, oh, look, you're having atrial fibrillation, you're having an arrhythmia, or actually this is completely normal. If this is when you felt it, it's not an arrhythmia, but we got to think about something else.
And our next podcast will be sponsored by Apple Watch. I mean, we have just done a whole thing on them. So tell me how much personal habits like tobacco, alcohol, and drug use play a role in maintaining a healthy heart. And I'm asking for a friend.
So generally speaking, unfortunately, many of the substance use and sort of things that we consider as poor heart health, which we all know, does in fact lead to poor heart health. Yeah. Now, they'll probably say the biggest one is tobacco. Now, just to give an anecdote from a clinical setting, I've had patients who have done everything right to a T. They see their physicians, they take all their medicines, they're on the top of the line therapies, cutting edge stuff, but because they're still smoking, they still land themselves in the hospital. And it's unfortunate because even with the best therapies and treatments, if those habits are still present, we see the outcomes can change dramatically. Now, where a lot of the field has gone, and maybe Dr. Doshi can comment on some of this as well, is that we are seeing that with specific substances, many of them, it can increase your risk of arrhythmia as well. And in fact, even for some people who are prone to atrial fibrillation, just having a glass of alcohol might throw them into atrial fibrillation. We have research that shows that. So there's definitely a correlation there with most substances. The one caveat I would make just briefly, which probably is almost a different question or a different category, is some of the heart health benefits of coffee. So it's sort of like the one vice I like to tell people about that may actually be good for you if it's used appropriately. So, but that's sort of a separate
and it's
situation.
really complicated. So the three things you mentioned, we don't see that much tobacco in this part of the country. We don't see that as much drug use, but what's very common is wine, right? Who doesn't love their glass of wine? And we always say we'd rather have you go for quality than quantity, but there are studies that show a certain amount of alcohol is good for the plumbing, but it's not good for the electrical. So you're balancing that, right? And so it really depends on the other risk factors that you have and other diagnoses that you have. So if you have diabetes, maybe a lot of wine isn't good for you because it's going to make that worse. And you have atrial fib, maybe it's not good for you. But if you have blockages, having a few ounces of wine a day will help your HDL cholesterol. So this is why it becomes more important to talk and sit down with your physician and make sure all these things have been addressed.
Absolutely. And so glad we're doing that. So let's talk about blood pressure and cholesterol. And they're also factors of heart health. Why are they important to keep track of? And what kind of therapies are available to help with maintenance?
Sure. So this is actually a really important question to hit on because when we talk about risk factors for heart disease, there's a lot of stuff that's out of our control. So you can't control age, right? Every time we go back into that chart to see the patient next year, the age never goes backwards. It only goes forward, right? So that's one. You can't control your family history, right? So some people are just more prone to this. Some people are born with congenital heart disease, right? So there's a lot of different things that can affect people that are out of our control. But blood pressure and cholesterol specifically are two of the largest modifiable risk factors. And this is really important because this is entirely in your control. So if you know you have high blood pressure, you know that you have high cholesterol, you have all the tools in front of you to actually make that better. And in some cases, make it optimal, right? So what's nice is some of the things we mentioned before, some of the lifestyle habits, they can help. However, sometimes even with our best lifestyle habits, no matter who you are, we may not get to those goals. We see this especially with cholesterol because cholesterol problems are an epidemic in reality. And in fact, I would argue is a large part of the reason why we have an epidemic of heart disease. But beyond that, that's really when we go into medical therapy, right? So we talk about prescribed medications. Now, some people get a little bit concerned. They say, oh, prescriptions like drugs, pharmaceuticals, oh my goodness, side effects, right? This is always on people's minds when they hear this. This is sort of the connotation. But I like to tell people a good doctor, a good cardiologist is going to find a way to put you on the right medication regimen that works for you, that gets the job done, has minimal to no side effects, and is going to work for you over a long period of time with a little bit of adjustment. And if we look at that as the trade-off, right, with, hey, you can take a few tablets, right? It's going to be tailored to you specifically. You're not going to feel any differently. And this is going to potentially save you from having a cardiovascular event, may improve your quality of life, may extend your extend your quantity of life. Then, these are really great innovations.
Exactly.
And I think people don't appreciate how important it is. So even dropping your blood pressure by 10 or 20 points, if that reduces your risk of stroke by 30%, think how powerful that can be, right? And we don't appreciate that, I think, out in the public. And what's really exciting about some of the things we're doing at St. John's is, hypertension affects over 150 million people in the U.S. And many people just aren't getting to that target dose. There's been a lot of research on procedures that can actually address hypertension. And we're going to be one of the few centers in the country doing clinical trials where we can do a procedure called an ablation around the kidneys that affects the release of adrenaline, which then lowers blood pressure. So patients who can get these procedures may be able to significantly reduce their blood pressure meds, but more importantly, actually get to a good target blood pressure, either on or off meds, things that many patients just can't achieve even after multiple medications. So the future is bright, and we're really focusing on how we can do some things that are more preventative to prevent the development of advanced heart disease.
So exciting and so encouraging, truly. What makes cardiac care at St. John's special?
That is a fantastic question. I think one of the biggest impediments to people coming to St. John's is that they've never been here. And what you realize about St. John's is we have put together a piece where we have the most advanced technology and skilled doctors, but in a setting where you feel like you're in a community hospital. And it overwhelms people because they're used to these big academic names where it feels like a train station and you're running in there and you talk to so many people, never quite get to the specialist. Where here you're seeing the doctor, talking to the doctor, and getting all these advanced therapies, yet you feel like it was specifically designed for you. And so we're very blessed to have the support of the administration, the foundation, nursing, every step of the way to make this what is so-called this community hospital a world-class leader in cardiovascular medicine.
I think adding to that, exactly as Shephal said, what you're going to get at St. John's is that personal touch. That personal touch. We have prided ourselves as a practice at the Pacific Heart Institute in being personal cardiologists, where we are really listening to where you came from, what has happened, and what kinds of therapies are likely to serve you best. And I think that really is the difference between us and a lot of other centers, is that we take the time to make that happen.
With atrial fibrillation, what are the new advancements there?
Yeah, so I think this is an opportune time to discuss. In the last year, there have been multiple studies that have shown that early and aggressive treatment with invasive procedures called ablation have better outcomes than what we've done for 20 years, which is medications. Now, with regards to atrial fibrillation, it's really important that we discuss this because in the last year, there have been multiple studies that have shown that early treatment with atrial fibrillation has much better outcomes, reducing stroke, improving longevity, reducing dementia. And the treatment that seems to work the best is a procedure called ablation, where we basically go into the heart through the vein. Now, while you're making that face, many patients think that's surgery. This is not surgery. This is an outpatient procedure. Takes a few hours. You go home a few hours later, and we can go in and rewire the heart and fix the wirings and reduce the outcome of atrial fibrillation and reduce the recurrence of atrial fibrillation, make patients feel better. And this is really what's going to come to the forefront in the next 1 or 2 years. The advancement in this technology to do this is leaps and bounds above anything else we're doing in medicine in terms of how quickly we're doing it, because we have an aging population and we're seeing more and more atrial fibrillation. And the science has actually justified our use of the technology because the outcomes are so good. And so at St. John's, we are a world leader in this. We're doing trials in this new technology with ablation called pulse field, which is actually not even being done anywhere in the Western United States. And we just did 3 cases yesterday, for example. So I think if you're a patient that has atrial fibrillation, the take-home message is go see a physician, but ask to see a specialist that treats atrial fibrillation. If you have other types of heart disease, ask to see a specialist like Dr. Tadwalker. If you want to do prevention, if you want to do other types of treatments, you want to move away from the general physician who kind of helps with the initial diagnosis, but then start seeing specialists, because with the innovative treatments we have here, we can make a significant impact. We see patients coming from all over the country and even outside the U.S., even those that are coming from a few miles away from the university centers that come to St. John's and have access to these new therapies.
That is wonderful and so encouraging. How did you two get involved in what you're doing?
I guess I'll start because I'm the older one of the two. I wish I wasn't.
Age before beauty.
Yeah, my interest in the electrical side of the heart really is not too interesting, except for the fact that when I was in training, I always found that to be the hardest subject. And, when you do electrical stuff, it's a completely different language when you're doing the procedures, because you're basically like an electrician. You're talking about impedance and voltage and resistance, things that the electrician does when they come to your house. But now you're talking about it directly in the heart. And I always found that to be the most challenging. So instead of being, fearful of it, I decided to just go train in it and learn it. And it is one of the hottest fields in cardiology because of the technology and investment being put into the field to treat these diseases. So I feel very lucky that, my colleagues that are plumbers, they work in black and white, and us electricians, we work in color. That's the joke I give them, because that technology really allows us to make some big impacts. And that's how I got started in this field.
I love that. You have to have a rebuttal to that.
Yeah, I guess so. Yeah. I guess going back even further, like my father is a physician, so I was always sort of exposed to the world of medicine. And I always had an interest in science growing up and through the school years, and how science connects to human health, and just seeing the impact that one can make from that perspective. For cardiology specifically, though, I have so many things to say that are good about this field. Part of it has to do with the fact that we've come leaps and bounds in this field. And when we talk about tech and innovation, it's all in cardiology. And the advancements that we've made in the field have been truly remarkable if you just look at it decade by decade. So I think this is one of the things that excites me and it keeps me sort of on the edge of my seat to want to go and do more and learn more about it. But what I try to tell people as well, why cardiology is so important and why I really find it personally fascinating, is exactly what we're doing today. It's relevant to everyone. There's very few people who will live their life without a cardiovascular issue or having some concern about a cardiovascular issue. Many people, it could just be a little bit of high cholesterol. For others, it can be very complex, like cardiomyopathy and heart attack and atrial fibrillation. Basically, it's relevant in so many different facets, and there's so many different ways to approach treatment. It could be everything from just sitting down and talking like we're doing today, to prescribing medication, to administering the right types of tests. In many cases, those are not invasive tests. In some cases, they are invasive, but they're minimally invasive, where we can collect a lot of information. And in some cases, we are delivering definitive therapies. We can even replace valves now, right? So it is without having to undergo a sternotomy or an open heart procedure. So we really have the full spectrum of care in cardiology. And that's what makes me really excited to continue onwards and practicing it, because we just are, innovating in so many different ways.
I think the sobering statistic is that the number one cause of death is still cardiovascular disease in the United States. And it's not just people clutching their chest and keeling over from a heart attack. It's from an electrical short circuit. It's from valves. It's all of these things. And when you have something that is so responsible for so much morbidity and mortality, there's no secret that's why the investments are going into that, because it's the number one cause of death. And that kind of also allows us to focus on what we do.
In closing, if you just had a few words to give to our audience, takeaway, what would your words of advice be for them?
Mine would be, hopefully after listening to us, we've done our job, which is not to scare you, but to at least relay to you how important it is to understand your heart health. And we don't expect you to have that knowledge yourself. That's why we went through all this training, but we're there to help you and guide you in that process. And so clearly, if you're having symptoms that could be related to heart disease, go see your physician, go get the right tests done, and then most importantly, go see the right specialist.
Right. Absolutely.
I would say my takeaway, and what I try to instill in people, especially today, there was a time when you may just see a cardiologist if you were gravely ill, or you had a heart attack, or you had some large issue that now we're trying to salvage. We're trying to pick up the pieces and trying to get you better. What's great about cardiology today is that you don't have to be afraid of what can happen, because there's so much we can do to try to prevent the onset of disease in the first place. There's a lot of people listening today who have really strong family histories of cardiac disease. It could be a grandfather who had a heart attack, or a mother who had a heart attack in their 40s or 50s, or a whole array of different things, because cardiovascular disease is so prevalent. My message is, don't be afraid, because we have all the tools available now to try to prevent that disease from occurring. And you could potentially be on a different life trajectory. It's not like you have to fall victim to that. So if it's done the correct way, we can prevent a lot of it. I'm not saying that we can treat all of it and prevent all of it, but we can do a lot of it, to the extent that you could have a very healthy, great quality of life.
And long life.
And a longer life. Exactly.
Oh, and that's what we all want. Well, Dr. Tadwalker, Dr. Doshi, thank you so much for being here on our podcast today. And thank you for taking care of our hearts. Literally, you really do. It was a pleasure having both of you. And we also want to thank the St. John's Health Center Foundation for actually making this entire podcast possible. And thank you for joining me today. And please send us all of your health questions to yourhealthydosepodcast@gmail.com. Until next time, I'm Kym Douglas with your Healthy Dose.